Reason Meeting 29 and 13. I am Ria.A&Selvia.P and my partner
Selvia.P.
And so, happy
watching! Meeting 29 having passion with diabetes management. Blood sugar test.
Label the pictures 1 to 5 below using the words in the box and identify which piece of equipment is not used in blood sugar test. Number 1, urinalysis sticks. Number 2, glucometer. Number 3, the testing strips. Number 4, lancet. And number 5, cotton swab. Next,
match the type of diabetes 1 to 3 to definition 1 to 3. Type 1, B. Diabetes controlled by insulin. Type 2, C. Diabetes usually controlled by medication, diet, and exercise. 3. Gestational. A. Diabetes during pregnancy. Discuss the following question in pairs. What do you know about the types of diabetes in above exercise? 2. What are some of treatment for diabetes?
answer number 1. What do you know about the type of the diabetes in above exercise? Answer 1. Type 1, muscle strengthening workout such as weightlifting, resistance band exercise, bodyweight exercise. 2. Type 2, yoga, walking exercise, bodyweight training. Gestational, pregnant woman exercise, aerobic exercise, pilates. What are some of the treatments for diabetes? Answer type 1, dietary supplement, insulin, hormone that regulate blood sugar level. Type 2, stains, insulin, anti-diabetic, and 3, gestational, anti-diabetic, and insulin.
I need to check your blood glucose level before you see the doctor. Is that okay? I'll just put up a test strip in the glucometer. Can you hold out your finger, please? I'm going to prick the side of your finger with this lancet. I'll put a drop of blood on the test strip. You can put the cotton swab on your finger now. We'll have to wait for the result to flash on the screen. I'll record it on your chart now.
Pay attention to pictures and complete the sentence using the phrase in the previous slide. An example has been done for you. Number 1. I need to check your blood glucose level before you see the doctor. Is that okay? Number 2. I'll just put a test strip in the glucometer. Number 3. Can you hold out your finger, please? Number 4. I'm going to prick the side of your finger with this lancet. Number 5. I'll put a drop of blood on the test strip. Number 6. You can put the cotton swab on your finger now. And number 7. You will have to wait for the result to flash on the screen. And I'll record it on your chart now.
Blood glucose level. 1. Answer E, less than.
2. Answer I, more than.
3. BGL, answer C, blood glucose level.
4. Cholesterol, answer B, amount of glucose sugar which sticks to the blood.
5. Glycated hemoglobin, answer A, amount of fat in the blood.
6. Hypoglycemia, answer D, high blood sugar.
7. Hypoglycemia, answer G, low blood sugar.
8. L, answer F, liter.
9. Mmol, answer H, millimoles.
Next.
Meeting 13. Asking a patient for consent. Question from Explain Diabetic Chart.
Nurses must always ask patients for their consent or permission before a procedure. For a simple procedure, for instance, testing a blood glucose level, it's enough to ask, is that okay? Or do you mind if I take your blood glucose level? For a more serious procedure like an operation, the consent must be in writing.
Next, make a short text about taking a blood glucose by using the following prompts to help you. Check blood glucose doctor. Test strip, glucometer, hollow finger. Prick side of finger and lancet. Drop blood. Test strip, cotton swab or finger. Wipe or result or screen, record or chart.
I need to check your blood glucose level before you see the doctor. Is that okay? I'll just put a test strips in the glucometer. Can you hold out your finger, please? I'm going to prick the side of your finger with this lancet. I'll put a drop of blood on the test strip. You can put the cotton swab on your finger now. We'll have to wait for the result to place on the screen. I'll record it on your chart now.
Next, complete short conversation between nurse and patient by using the word 1. Can I take your blood pressure? 2. Do you mind if I do your dressing now? 3. Is it okay if I check your blood glucose level? I need to see your identity bracelet. Is that okay? 5. Is it alright if I give you this injection? 6. I need to put up a new IV bag. Is that alright?
Study this sentence A to F. A. Good morning, Mrs. Hilda. I'd like to ask you some questions about your lifestyle. Is that okay? B. I'm going to phone your GP about your diabetes medication. C. Mrs. Hilda, the doctor will explain your operation to you before you sign the consent form. Is that alright? And D. I'm going to give you a shower. Take your pyjama off, please, and come to the bedroom. E. Do you mind if I do your blood sugar level now? F. Please can you roll up your sleeve? I need to take some blood.
Next, the steps are good example of asking for consent. A. Good morning, Mr. Hilda. I'd like to ask you some questions about your lifestyle. Is that okay? C. Mr. Hilda, the doctor will explain your operation to you before you sign the consent form. Is that alright? E. Do you mind if I do your blood sugar level now? 2. How can you improve the bad example? B. I'm going to phone your GP about your diabetes medication. D. I'm going to give you a shower. Take your pajamas off, please, and come to the bathroom. F. Please can you roll up your sleeve? I need to take some blood. Next.
Answer this question based on the slide 9. When is Mrs. Beskar taking insulin? Yes, she is. 2. How often does Mrs. Beskar test her own blood glucose level? Answer before breakfast and in the evening. 3. How often does Mrs. Beskar visit the diabetes clinic? Answer Mrs. Beskar visits the diabetes clinic every 3 months. Arigatou